All right, God bless you, and thank you for any one that is joining this live. Thank you for that, and for those that will be able to view this later. I just want to thank you real quickly. We're going to just take some time out, and I wanted to review my most. I'm having a problem. Bear with me for a second. Okay. All right, there we go. Sorry about that. I wanted to follow up with those of you that have been following this blog, as it is important to me to be sure to give someone the information that they may not have answers to, but this is my lupus diagnosis and the journey that I'm on. And I'm sharing it with you to let you know what the outcomes are and some of the attempts to address it are, as well as my decisions along the way. So there has been an update, and I wanted to share that with you. So if you will, you know someone that suffers with autoimmune diseases, any type of autoimmune disease that may be similar to this, like lupus, fibromyalgia. Um, I think MS is one, Sjogren's disease. There are a lot of them. They all affect the autoimmune system. I wanted to address it because of the treatment that is being used. So, if you will, share it with someone, or if you know someone that may be able to benefit from it, then certainly let them know that I will be happy to let them know whatever I can let them know by way of experience. So today, I am going to update you on my last doctor's appointment, which was a blood test. God bless you, Elder Mims, which was a blood test to check the markers. As you remember, I went on a specific diet that was to help the immune system by getting rid of the all the inflammation, or as much as I possibly could, what was reasonably decent um, diet that would address the inflammation in the body, which a lot of people are suffering with immune diseases and need to get rid of the inflammation. That is where the pain is coming in at. So I changed my diet, and some may know that I talked about a book called Goodbye Lupus, and it's by Dr. Brooke Goldner. And many of the things that she teaches in there, I have been following. So that would be from the diet to the activities and just regular watching her and listening to everything she had to say, because she was diagnosed at the age of 16. She was almost losing her life. Praise the Lord, love you, and I pray you have a beautiful Mother's Day with that beautiful family. But she 16. So she went ahead and um, went to school, became a doctor, and in her learning process, she decided to try to find some type of a cure or relief for this disease. Now, she had kidney failure already. She was 16. She had kidney failure and terrible pain throughout her body. So she was in the advanced stages of lupus. She went to school. She came out with her doctorate degree, and she pursued this healing for this disease. And that's when she found out that there was a change in diet that would be effective. And the change in diet was to include in your diet uh, the things that are going to heal or energize your body's healing ability, which is to give you energy in your mitochondria, which is where your energy is produced in the cells, so that your body can work, so that it can have the energy to do what it's supposed to do, i.e., the autoimmune system needs to be able to work. Well, this is an attack on the immune system. So she pursued that, and she did find out that healthy green vegetables, fresh fruits, fresh vegetables, uncooked fruits. Oh, I hope, and listen, you're going to want to hear what I have to say, dear. Elder Mims. You can alleviate the pain and you can alleviate the build up of inflammation by changing your diet. Now, the first thing that I think you would agree with me is probably we need to decrease the inflammation that is currently in the immune system. So, they say that most disease is right there in your gut. It comes from your gut. So, what you're putting in to your body by what you eat is getting into your bloodstream, and that carries it to every single cell in the body because the body needs the blood for oxygen and, to pick up all of the toxins that are there and dispose of those and to bring some fresh oxygen to the cells, etc. So there is a problem if there is excessive food in your body or you're putting food in your body on a regular basis that is creating um, the inflammation. So let me give you an example. If you have a cold and you're trying to get rid of that cold, then one thing you don't want to do is eat dairy food because dairy creates inflammation. So now you can find that if you reduce the intake of your dairy food, your milk, cheese, butter, eggs, ice cream, a lot of things, even acidic foods. I love tomatoes. I had to stop that because tomatoes I found out it would create inflammation in the pancreas. And we don't want to do any damage to the body, but we have heard so much about damage to the pancreas. So, and the suffering that follows it without being specific. But so a lot of things I found out that I had to get out of my diet to get it out of my system and put in healthy foods and then see how my cells can start to heal and how my energy levels can go up so that my immune system can work harder and so that it can fight harder against this terrible disease of lupus. And I changed my diet. Now, there was some things that I started off doing. I started off very aggressively because the pain was so incredibly intense at every single joint in my body. One night I woke up in the middle of the night, pain in every joint in my body, it seemed. I couldn't walk. I couldn't pull the covers back. I didn't know where this came from. I was fine when I went to bed. But in the middle of the night, I had to have help from my husband to even lift my head off the pillow. That is enough of a shock to stun you into finding some type of method of relief. All right, we always know that doctors have medicine for pain, but then if you take pain medication and it helps you, the pain medication is going to hurt because it has side effects. So while you're fixing one problem, it's creating other problems. My husband had a procedure and they gave him for pain ibuprofen. Well, he doesn't take anything. He just, does everything naturally. And this search for relief for pain drove me right to that vial of ibuprofen. And lo and behold, I was able to think again. The pain was so intense. It was just the saddest thing. I mean, it took me down to just whimpering and fear that I could not live with that kind of pain. And then after I understood that there are things that can help you with this pain, I did what I had to, but I got to the doctor. When I got to the doctor said, it is indeed um, rheumatoid arthritis and mild lupus. That was mild lupus. It wasn't anything like what Dr. Brooke Goldner had when she was 16. Her kidneys were always failing. So my mother was on dialysis and my sisters were on dialysis because they had diabetes, which affected their kidneys, and my mother was hypertensive, and that severely affected her heart and her kidneys. So I just wanted to do anything to keep them going that way. So when I got to the doctor and she diagnosed me, and then I talked to my children one by one, they gave me their information. My husband is being there for me, but I found out that above everything, I was going to have to change my diet, or I was going to have to go with the doctor's suggestion. The doctor she had a treatment ready that they use for lupus and autoimmune diseases where the body is fighting inflammation and pain is so intense that people are willing to try things. Now, I have got a list I am going to read to you, and I want to give you my outcome. So let me go back to the diet. Now, with the diet, I decreased and eliminated a lot of things. I was very aggressive in the beginning. I let go of my milk, butter, cheese, tomatoes, ice cream, all of those things that I used to just absolutely love. And I got that out of my diet. All right. So now I have reduced the amount of inflammation that I'm creating by strictly by what I'm eating. All right, I've reduced it. So now my body's not just accumulating and accumulating the inflammation causing foods. Now I decide, since we've decreased the problem or putting it in there, we need to get rid of what is in there, the excessive that was in there. And I found out that things like turmeric, ginger, alfalfa, and there are a number of other things that, but those three were the most important to me. So I put those into my regimen. So I started taking turmeric capsules, which turmeric is a healthy, natural, holistic cure for so many things. And I think mostly I found it to be so in the Indian community. I had an Indian doctor, and she wanted me to put turmeric in absolutely everything, even if I'm cooking cabbage, put it in there. You need this. But I found out that those things would start to aggressively remove the inflammation that was in my gut, in my joints, specifically in my joints, in my bloodstream, and I started taking that aggressively. So I got on a regimen. This diagnosis was given back in September or October of last year. So I started working on this, removing those foods and putting in those inflammation uh, decreasing or, eliminating, um, I should say, supplements, because they're mostly supplements. All right, so those two things were important. Now, I looked into her diets a little bit more, and I found out that if you eat not just vegetables, because they will heal the cells in your body, but raw vegetables are a more aggressive approach. Because when you cook, as you know, hi James, love you, nephew. As you know, when you cook your food, a lot of times, you may put water in it, boil the nutrients out of it, not all of them, but you're losing a lot in the water when you fry it. Well, you're cooking the nutrients out with the grease and the oil and the heat. So she made it very clear that you need to look into what's called hypernutrition. Hypernutrition, and James, you may want to hear this, sweetheart, but hypernutrition is when do you go to extreme measures to get every single nutrient or whatever healthy values are in those foods. So what she started doing was making smoothies so that she could take in her vegetables in a very simple way. Now, here's what she said in there. She would talk about, and you can choose, like if you want to use your broccoli, kale, spinach. Spinach pretty much is easy because it takes on the flavor of whatever you put in there with spinach. Broccoli, and kale, to me, you need something with kale because to me, there's a bitterness in kale. So what she said you should do is in your smoothie, while you are blending it, to put your fruits in there if you want to sweeten it up. Put frozen mangoes, frozen strawberries, frozen cherries. I think I used also, but you use the frozen ones because it makes the food cold, so that when the blender is blending the food, whatever heat would have come off of the blender will not affect the nutrients in the food. So she's very strict about it. So I used that method and I started taking these. Now, let me just tell you, only weeks, maybe even just days into it, not eating those other foods, I found out that some of those foods just make you feel heavy, lethargic, a little tired, weak, or they just kind of make you want to just relax, or you don't have energy because some of those foods are just, attacking your energy levels in your body. Then I found out, as I continued, I found out that I just felt good. Maybe I'm not healed. It's just been a few days. Hey, Paris. But I felt better. I didn't feel the heaviness. I didn't feel the tiredness. The loss of energy was kind of, it was going away. So I was doing better in that. And I was happy with that, but I still didn't want this lupus. So I continued to go along with this diet. Now, did I cheat? Absolutely. Absolutely, I did because I wanted, hey Tim, I wanted to, enjoy a little sugar here. I wanted, some zucchini bread, or, there was one time when I said, I know this is bad, but I want a Jamocha shake from Arby's. So that's ice cream and, milk, and it's just so good. But I cheated a few times. But for the most part, I stuck with the diet. So I cheated here and there. All right. Then I had another flare up. All right. Now, I will tell you, nothing was like the first flare up. Nothing. So I had this other flare up, and I said, I know I shouldn't have cheated, but I didn't think that my body was going to flare this quickly. I thought I'd have to put a little more abuse on it before it would affect it, but it didn't take much, which means the levels were coming down, and before they can get to a good lower level, I was already putting sugar and dairy products back on top of it. So my numbers increased. I went to the doctor and I had blood work done, and I decided to wait to get that blood work done after I'd gotten back. Well, I guess became a little more strict on what I ate, what I didn't eat, how I rested. That was big. I started resting at night better. Um, and I waited until I felt like I was on a good, streak here as far as eating and staying away from the things that were hurting me. All right, so I said, I know I haven't had a flare up now. And so since I did this and I went back to the doctor and told her about the flare up, and so I said, I told the doctor, I want you to check my numbers because I want to know if this is working. I want to know if it's healing. I want to know if we're getting any progress. So, she was apprehensive and she didn't look too optimistic about it. And she pretty much made me feel like, yeah, you're one of those people that thinks you can do things without medicine. Well, the medical world believes that that is where the answers are, and that if they don't succeed, meaning if you die or you get worse, that is failure on their part. So let's get more aggressive. And while we're getting more aggressive, let's try this and let's go to these levels. Let's give these dosages and let's give this frequency and see how this works. And you know what that sounds like? To me, it sounds like experimental, just practicing medicine, trying to get it right. And I don't want them practicing on me. So I did not want to go back into another flare up. And I found out as I kept searching that it can heal multiple sclerosis, it can reverse that. It can reverse Sjogren's disease, which is the skin, and also other like your psoriasis, and that was a problem with lupus because when I would eat something sweet, there would be itching on the back of my neck, and then I found out there was a little rash. Well, a lot of people get a rash right here, like butterfly. It's like butterfly wings here, and then it goes across the bridge of your nose. It's a very distinct pattern of a rash. But I did start getting it on the back of my neck, and so every time I ate something sweet, I said, now I'm gonna go through something because my body will pick it up even if it's just in the skin. So I know I'm making a long story out of this, but I really want you to hear this. But so anyway, I had a few things going on there. So I was learning a few things about, what I may suffer, and it may be a flare, but it may not be in the joints like that first one. Nonetheless, it was a flare, which was an indication that your activity, your lupus activity, has been stimulated. And that means it's going to get worse, and your body is going to continue to accumulate, and you may just break down and find yourself in the emergency room. All right. Many of you that know me know that I just had to have emergency surgery to have my gallbladder and my appendix excised or removed, and that was that was difficult. But I wanted to know if the lupus had anything to do with it. Well, the doctor said it usually affects the kidneys. So I said, well, I did read that it does affect the skin with rashes. And she said, well, you'll have to go to a dermatologist. To me, this had been the nicest doctor. She was my doctor back in 2007 when I was really, really sick with arthritis. And she was just the kindest person. But I think she was just, at some point, maybe she's just been through so many patients that, she may be losing her bedside manner. And then also she may be a little bit frustrated with me because I don't want to go through the treatments. All right. So now I go back and I am so happy because I've been on a streak and I give my blood. That's how they check your markers. They check to see, what is elevated, what is normal, what parts of your chemistry are declining. They can tell by your blood. So that's what I mean by markers. And so they looked at the blood, the results, and she didn't respond. So I am the hospital that I'm at. Usually, when you give your blood, before you can get in the car good, you're already getting your results from your blood work. However, I did go on a Friday, and they're not going to work on the weekend, and it was the end of the day on Friday. So I'm looking for results by, Monday, Tuesday. All right, no response. So a week goes by, and she does respond. She says, yes, Valerie, your lupus is showing activity. I suggest that you go with the treatment that we spoke of. All right, so the treatment we talked about is a drug called hydroxychloroquine. Hydroxychloroquine. Now, if you can remember, it wasn't that long ago, but during the pandemic, they were trying desperately to find a cure or some type of treatment to address this pandemic. And hydroxychloroquine came up because they treated malaria and prevented malaria with this drug. With this drug, so they felt that it would also work in the immune system to address the COVID-19 virus and all of the germs and the viral properties that came through that. So when she offered it, immediately alarms went off in my head because I watched everything they did, and it seemed like it was, number one, it was it was just, let's just try this. It was just an experimental, let's try it and see what it, throw everything against the wall and see what sticks. That was the way I looked at hydroxychloroquine. However, some people, it said it saved some people's lives. So I was very taken back because I didn't want that. So what I did was looked into hydroxychloroquine, and I wanted to know what the side effects were. But I asked her, is it a steroid? And she said, it's not a steroid. So that was good. I said, will it suppress my immune system? She said, it will suppress your immune system, but it's not a steroid. So if it's going to suppress my immune system, then it means that the very healing I'm trying to get to the immune system is going to be held back from doing the work that it should be able to do. And that sounded so counterproductive to everything. So I did not want anything to suppress my immune system, because if my immune system is not working, then my body is open to everything. It can't fight off free radicals like it needs to in order to prevent cancer. It can't fight off colds or viruses. And the world is full of them. You can't go into a building, touch a door or anything, computers, everything and everywhere, no matter where you're at, wherever people are, wherever their hands are at, wherever they sneeze at or cough at. Those are the things, because some of those pathogens will live, and those bacteria will live on the surface of, metal surfaces, counter surfaces, wood surfaces, computer surfaces, in the air. They sneeze, it can linger in the air. So I just didn't think that suppressing my immune system was a good idea. So I turned it down. All right. And I really think that I lost her when I turned it down. So I said, well, let me go back in, and I'm going to be more aggressive, because I did, get off track with my regimen. And so I did go back to my diet, and I also went back to eliminating the inflammation causing foods like your dairy, like tomatoes, cheese, butter, milk, ice cream. Also, I had to realize that those fatty foods, the fried foods, they get into your system and they feed those weak cancer cells, free radicals. They feed those or those, I don't know how to put it, but those cells that are not thriving, this works against them. So I had to give it no fried food, no fast food. I did cook some food, but every day I ate fresh vegetables and fresh fruits, and drank lots of water. That's another thing. You have to hydrate your body, because lupus will dehydrate the body, and I found that out. My eyes would be dry, and my skin sometimes would be dry. I'd have to use extra lotions and things to just get skin supple again. So it was really serious. So everything that I did after I went back, I said, I have got to get rid of this disease. I'm going to definitely be on the right list. So I did all that. All right. And then she does the blood work, and finally she calls me back. Well, actually, she sent a note in my chart. And when I looked into it, it says, yes, it's showing activity. I suggest you take the treatment. So I responded to her by saying I considered it, but the side effects were disturbing. I didn't get a response from her for a couple of days. Now, I want you to listen to this, and then I got to tell you something that's going to be so ironic that you may be encouraged by it. All right, so one of the things that she said is to go back. What you're going to need to do is you're going to need to either take this treatment, or if you don't want to take the treatment, okay. So I said, well, what would be my next step? And she said that I should go back to my primary care doctor, and going back to my primary care doctor would simply mean that I would be asking her for something to help control pain, because the disease was going to progress and pain was going to come back. And, if you can give me medications that I'm not afraid to take, and I can stick with a diet, I'm not afraid to eat certain foods because they will hurt my body or create inflammation that will severely cripple me. So she sent me pretty much back. So then she asked again, and I said, well, are there any alternatives to the treatment? And after a couple of days, I got an answer. But let me read to you before I tell you that answer. The treatment again was hydroxychloroquine. Now, they gave this to President Trump in his first administration when he came down with COVID, and they had to throw everything at it because it was advanced. And of course, they weren't going to send him to Walter Reed Hospital and, lose the president when so they gave him everything. They doubled the amounts that they said should have been the maximum, so they gave him a lot. And ultimately, he overcame it. Now, let me read to you these side effects. I have it on the screen here, so it may look like you can tell I'm reading. Here's the side effects of the drug that she suggested strongly that I go with. All right, number one, gastrointestinal issues. So you know what that is, your digestive system. So those side effects are nausea and vomiting. Even pain medicine will do that. Diarrhea and stomach pains and cramps. All right. In order to manage this disease, not heal it, I would have to subject myself to those gastrointestinal issues. All right, that's not it. Then there were skin issues. Now, I mentioned to you rashes, and I knew that your skin is definitely going to take a hit in most cases. So, because you get rashes, even if you eat foods you shouldn't eat. And then here, this medication would additionally create rashes. All right, then there was itching. And that, to me, sounds absolutely just maddening, to rashes and itching and diarrhea and vomiting and nausea and stomach pains and cramps. What am I doing? I'm laying in the bed just going through the throes of the side effects of what was supposed to get me a solution to this disease, lupus. All right. Additionally, side effects are headaches and dizziness. So what does that do? That lays me on the bed because you don't want to take a fall. I'm not 17 anymore. So you don't want to take a fall. And headaches can be, so severe. You need the lights off, you need quiet. Those are side effects. Other side effects are loss of appetite. So if I have loss of appetite, then I'm not feeding my body the nutrients that it needs to heal. So what am I doing? I'm getting further into a hole. The nutrients and the all of the things, the calcium levels, some of those markers are going to decline just because of the vomiting and the diarrhea, because your body is releasing whatever was in there, and it's just absolutely miserable, and you're having stomach pain, so you're not going to want to eat. So loss of appetite was another. Here's something that I said, you're really pushing it. Loss of or blurred vision. They say it's temporary, but if I'm out and about, I don't need my vision to be blurred at all. Even if I'm at home and I'm bedridden, I don't want to lay in bed and then all of a sudden I can't see what I'm looking at on TV, or if I'm reading a book or studying. That's another miserable side effect to this hydroxychloroquine. All right, now those were the common side effects. So let me give you the serious side effects. The serious side effects were or are eye problems, retinopathy, meaning danger to the retina. So my changes. I would have changes in my vision, and I would have difficulty seeing in the dark. I just don't feel that I could function on the level that even if I wasn't working, I don't feel that I could function very well. And it probably come pretty discouraging and difficult. I might not be able to get out and go to church. I may not be able to do any shopping. I may not be able to do any entertaining or visiting. It says change in color vision. Now, what I'm seeing is not only blurry, and not only is it um, darker, but the colors are obscured. So that's awful. All right, next is muscle weakness and nerve damage. Now, they say you can't get rid of nerve damage, but there are things on, and I can't think of what it is, but they will help with the nerve damage. All right, so my husband has tingling sometime in his feet and his hands, his extremities, because of he has low tolerance for food with sugars because he's a borderline diabetic. And that keeps him from going all the way into being a full-blown diabetic. But this diet that I'm talking to you about with Brooke Goldner, it actually reverses diabetes. All right. So the muscle weakness and nerve damage includes muscle cramps. Have you ever had a Charlie horse? Or have you ever had a pain or a cramp in your foot or in your leg? The thought of that is awful. Tingling and numbness. Now, let's go to the heart problems. Cardiomyopathy. And that's just a word that means your heart is going to get weak. So now we're looking at something that could be fatal, something that could be just disabling. I mean, you'd be debilitated for sure with all this going on. It also brings about changes in the rhythm of the heart and heart failure. Now, if your heart beats too slow, then you're going to be weak and you're not getting the regular pace of blood flowing through the body. All right. Then there's an arrhythmia, which is where the heart speeds up. And so my mother had that. It was arrhythmia, and her heart speeded up. But, it's going from 80 or so, somewhere between 60 and 80 beats per minute. I may not have that right. All right. But it was going up to 200 and 300 beats per minute. So if you can imagine your heart being a pump, it is going to be doing this. Now, and that'll get you 80 in a minute or whatever, 60, whatever it's supposed to be, whether it's resting or after activity. But if it is going up to 200 and 300 times per minute, then it doesn't have time to do this. It's just going like this because it has to go so fast. So it's simply going, which means the heart is not completely contracting. What does that mean? That means that you're not getting that thrust through the veins, which means the body is not getting enough blood in a period of time, which means your cells are not getting enough oxygen. Now, don't just think it's muscle cells. Yes, that. Your heart is a pump. Your lungs are a pump. Your brain also need that oxygen. So if the brain is not getting the oxygen that it needs in the right pace of time, then it could be like you are going into a phase where your brain could cease to function. And that can happen within just a few minutes of arrhythmia. So that is why you'll see people, if they are if they're in the hospital and they have to shock their heart with the defibrillator, they have to shock the heart back in the normal rhythm pretty quick because after so long, the brain and the other organs are not getting the oxygen they need. And so damage begins to set in. And that's why they tell you, nothing's going to function where it used to be. You'll just be weak. You'll be living a life of not being able to do anything. And possibly they used to use the term vegetable. All right. So cardiomyopathy. Cardiomyopathy is another side. I want you to hold on because I want you to hear the end of this. Blood cell problems like anemia, you have low blood, white blood cell count, which again, the white blood cells are the blood cells that fight against the free radicals and anything foreign in the body. So that's why if you get a kidney or transplant or something else is put in the body, well, those white blood cells are going to detect it and they're going to fight to push that out of the body. And that's what they call your body rejecting an organ, or you get an increase in white blood cells and you don't want to increase in white blood cells. It can cause, I've seen delirium come out of it to the point where the person didn't even seem to be speaking their native language. And neither were they able to be cognitive of fully of what's going on, and you're watching them suffer. I've seen it all, but all right, let me go a little bit further. So then here you don't want this one, liver problems. All right. Now the liver is capable of reproducing itself. So you can cut off a piece of the liver or lose a piece of the liver and it will restore that lost part. But elevated enzymes and liver failure, and your liver is a filter. So you need that to filter what's going in and out of the body. And if that liver is not working, there is I think Billy Rubin, that number, biliary levels are what comes out of the liver. And when you don't have that, people become jaundiced. That's when you see the yellowing of the skin. So these are all horrible side effects. Here's one, hypoglycemia, low blood sugar. Now, your blood sugar being high is one thing, but when your blood sugar is low, you could just be fine 1 minute and on the floor the next. That's just how quickly hypoglycemia can affect the body. Now, I may be stretching it a little bit, but I'm giving you a good idea of the things that will happen. Psychiatric issues, mood changes. On top of all this sickness, I got mood changes, depression, anxiety, suicidal ideation, all of those things are a side effect of hydroxychloroquine. I'm almost finished, but I want you to know because you're going to love what you hear next. All right, severe skin reactions, Steven-Johnson syndrome, toxic epidermal necrolysis, rare, it says it's rare, but potentially life-threatening. So necro means death, okay? And, that I can't remember what the lysis means. I just took medical courses, but necro means dead. So you could get dead tissue, severe skin reaction. So it could kill some of your skin cells. And so you know that when skin cells die and they're not getting the blood flow, they're not getting the oxygen, they're not getting rid of the toxins, then, that tissue can one of the things that can happen is that you could get gangrene, among other things, but the body can't hold on to that dead tissue. All right, allergic reactions like rashes, hives, swelling, and difficulty breathing. I just don't, are you really observing what I'm saying? That this drug they want to give me, it could do all of these things to me? Any of these things would be bad. 2 or 3 of them would be awful. All of them would be a reason to be depressed and full of anxiety. All right. And then it says allergic reactions. Now, here's the note. Take this in. But the note says, important note, the risk of serious effects increase with long-term use. So if they decide that you just need treatments for a couple of weeks, then maybe it will take care of the problem and you'll be okay for a while until you need it again, if you need it again. But if it doesn't, and they have to increase the amount that you take and increase the amount of time that you need to take the treatment, then those side effects or the risk of getting those serious side effects, not the common ones alone, but the serious side effects, that's going to increase your risk. All right? Higher doses and pre-existing conditions like kidney disease and heart problems. So if you have any of that going on, then this is going to spill over into your treatment or the debility that you may be in concerning your kidneys and heart. I just want you to get the fullness of this. All right, the next thing, and there's only one more, is regular eye exams are recommended for individuals on long-term hydroxychloroquine therapy. It says it is crucial to report a new or worsening symptom to your doctor promptly. So do you see where it's an ongoing series of, watch and see and wait and hope and just taking a chance is almost like gambling on being sick for sure. So that is what they offered me in medicine that would do all of that. All right. Now, remember, as I said earlier, I considered when the doctor suggested I take it, I said, I've considered it, but the side effects are disturbing. And what I just read to you are the side effects. All right. So I didn't hear from her for a couple of days. I guess she's taking her time dealing with me. And she finally did follow up 2 days later. And this time she said, well, if you don't want to go with the treatment, then you can go with what's called functional medicine. Functional I like, medicine I'm a little leery of. So I looked it up, and functional medicine, you'll be happy to know, is a natural or a holistic approach to treating the disease. And the got a knot in my hair. The treatment that they said functional medicine is using food to treat the illness versus medicine. So what does that mean? We are back to Dr. Brooke Goldner and similar books and diets that treat the sickness or the illness with food and not medicine. All right, so which one do you think I chose? So I have an opportunity to go in and to be a part of this particular medicine, and I looked it up, and I may even go into it and get a certification because, well, it's not too expensive and it doesn't take too long, but it's just good to know because whatever I get, I'm going to pass on. So that is my update. Yes, I had a problem. Yes, you are so welcome. I had a problem. Yes, I was afflicted. Yes, it came back, but it never came back the way that it did. So here's what I want you to take from that. It wasn't wasted that I did change my diet. Though flare-ups came back, nothing came back as bad as it did. All right. That was a few months ago. So that was maybe 3 or 4 months into the diagnosis that those flare-ups came back. All right, and today, the past couple of days, and I've had to have my husband to pray for me because I've had some pain. So, my ankles, and I've had pain in my hand, and then I noticed swelling in my joints. Not bad, not bad at all, but balling my fists up, I can feel the tightness in the joints. Now, what do I do with that? I continue. I'll go into the functional medicine. I continue my diet and make a special note that though there have been flare-ups, they have not been severe. And they're getting further and further apart. So they're months apart, and each one is less severe than the previous one. So what should I think? I'm going to go ahead and be encouraged by it is diminishing. It is diminishing, but it's with consistency. And if you cheat a little bit here and there and you have a little side effect, you have a little eczema or something, or you get a rash, like I said, I get the rashes on the back of my neck, or some mild swelling in the joint, a little pain, nothing matches what happened that drove me into the emergency room that night. So it's getting better. And instead of constantly pushing the hydroxychloroquine, they're now telling me to do what that book, which is my son did, suggested, Goodbye Lupus. All right. So because of that, I'm going to ask you to follow me on yeah, God bless you. You've got a lot you and I have, definitely come through some stages. And I think we can get there. We can get better and better. So I feel better and better. It's nothing like, and I don't anticipate it getting as bad because I'm not going back to all those foods. And I'm not going to stop taking the foods or the supplements that reduce the inflammation. So those two things work. And I'm not touching hydroxychloroquine at this point. I don't see a need to. But I am going to go and see the functional medicine. Well, I don't know if you call them a doctor or practitioner, try it out. And then, of course, I'll be updating you. So let's get back to reducing or eliminating your dairy food so that you can stop putting the inflammation creating foods into your diet or into your body. Let's begin to take the supplements that reduce or start to eliminate the inflammation that is in the body, the excessive inflammation that is in the body. Let's start getting that out of the gut. Okay, your benefit right away is that you reduce the pain causing situations. And the next thing you need to do is get on that hyper nutritional diet. Okay? Hyper nutrition simply means, and she's extreme, and I haven't gotten extreme as her, but I have begun to lean more and more toward it. Eating raw vegetables and fruits every day. So what did I do? I'm not going to sit here. I tried it, and I may do it every once in a while. Some broccoli and avocado dip. Avocados are very good. So I didn't like guacamole, so, but I said, if it's going to stop this pain, I'm going to try it. I'm going to learn to like it. So that, or I would do it with a ranch dip, but then that had a little dairy in it, because I think there's cream cheese in your spinach dip, and so I said I'll try it. So I do that every now and then. But to get those vegetables raw, I will have a salad. I'll just make sure I have fresh spinach. I don't like the iceberg lettuce. I like the romaine. Have romaine. And it's crazy because when I go to a restaurant, I'll tell them, and I shouldn't do this, but I get eggs on there just for diversity. I'll get some croutons on there. No tomatoes, but I will have cucumbers and, if they have chickpeas or something like that, along with the romaine lettuce and oil and vinegar dressing, then I'm getting that. So even if I instead of ordering something else for appetizer, I'll go ahead and get the salad and be boring, but I won't be hurting and I won't be tired. I'll be feeling good and I'm getting rid of that stuff in my body. So the hypernutrition, and let me give you this, for the hypernutrition, go ahead and pull the blender out. Get a big bag of either kale or a big bag of spinach. Spinach to me is easier. So when I put that spinach in there and I put in those frozen mangoes, cherries, or strawberries, the spinach takes on that flavor and it sweetens it. I put those in there frozen so that they won't let the blender heat up the food at all, not even in the least. And then I drink it, and that gets those nutritions, and my cells get a delight for that day because they're getting what they need to have the energy to fight the disease. Okay? That is my update. And I want to thank all of those that have encouraged me. So many people have come on and thanked me for these lessons and or these discussions. And some have encouraged me to know that it helps. And I just want to thank you. And I want you to know that you are free to subscribe to my channel. Yes, functional medicine. Let me put that up there. Functional medicine. That's what you want. Look into that. It will tell you that it allows you to find foods that will address the sickness versus medicine. And any medicine that is capable of doing all of that, they need to keep it away from me. Another thing was it can make your hair fall out. So it sounded like chemotherapy to me. It was just, no, I don't want to create all those problems, losing my eyesight, losing my hair, getting all kinds of rashes and weakness, my vision going bad. I don't want to take all something that's going to do all that to me to reduce the inflammation when I can do it naturally. So our next step is functional medicine, and you will be getting an update on that. So thank you again for those that have encouraged me for doing that and for having these sessions. You can count on me. If I get a word, I'm going to share it to you. I'm going to be transparent, and I'm going to let you know exactly how it worked or didn't work, or how I appreciate it or don't appreciate it. I'm feeling good. Believe it. I did a full house cleaning today, deep dive, and normally I would be tired, but if I took that medicine, I'd be too tired to get up and do anything. And I am too young for that. Until I'm 115, I do not want to be laid around in a bed looking for somebody to bring me some water so I can take a pill. I don't want that. So I'll tell you about functional medicine. I'll update you. Okay. And if you do desire to go in and to do anything concerning, where did I put it? Concerning, if you do decide to go in and do anything, oh, here it is. Okay. Concerning getting on, if you have questions or things, how things are going for you, you want to talk about what is working and what's not, drop a line to me on my Facebook channel. And the Facebook channel is right there, Reset Forever Ministries. Now, you may see in your lower right corner a YouTube icon with red. If you click on that, it will let you subscribe, or just go to Reset Forever Ministries and subscribe, and it will give you a notification whenever I come on, as well as you would be able to leave me a note or a comment, and that's going to help. So I'll include it. All right, with that, I'm going to say thank you for joining. Marie Holder, God bless you, my dear. All right, so with that, I'm going to say thank you so much for joining. Hey, mothers, have a wonderful, happy Mother's Day, and let us just enjoy the weather, enjoy the family, and enjoy all the love that we have coming. All right, and with that, again, thank you. Now, to those of you that follow me on Monday, we are in the book of Zechariah. Oh my gosh, you are going to. I thought Ezekiel was amazing, but this man has 8 visions in one night. Mm. And the reasons and the details behind it, wow, I can't wait. We're going to consult some of the other prophets. I think it was not Nahum, but it was Haggai. Haggai was his contemporary, and he explains a lot of the things that had to happen because, or a lot of the things that Zechariah had prophesied had to happen. And um, gosh, not Nahum, I said it again. Oh, okay, so that Haggai will tell us why. Not only Haggai, but Ezra. Learning where these people prophesied and how they can give their side of the story is incredible. And you're not going to find them to be very far off from what we're seeing today. So this is some good information because it tells you this is God saying, I am going to pull back the veil and I want you to see what they're doing in the spirit and I want you to see the influence, but I am going to show you my approach and I'm going to show you how I do it in the spiritual realm, what your natural eyes cannot see. Zechariah is incredible. I'm sad that they only have 14 chapters and you could probably go through it real quick. Probably end up talking to Micah. Micah has a lot to say about this. Anyway, 5 o'clock on Monday. All right. Have a beautiful Mother's Day. And thank you so much, my dear Sister Holder. And God bless you all. I love you in Jesus' name. And happy Mother's Day to you again.